Welcome back, everyone. We'll start with our next chapter, which is health and diseases. But before we start, if I'm audible and visible, please give me a thumbs up. If all's fine and you are able to hear me and the video is visible, good. Although I see that some of you are still joining, I'll just give it probably 30 more seconds. All right, let's start after that. All right, so let's start. So now in this part of the lecture today, we are going to discuss about two chapters. One chapter is health and diseases, and the second chapter is vaccines. All right. So these are the two topics that we are going to discuss. Now, again, these are two topics that have been not mentioned in your syllabus as such. I mean, neither prelims nor means, but these become important topics because they are related to science for one, and secondly, they are areas which very often are in the news also. So that's why we need to understand some of the basics related to these areas. Now, first, to start with health and diseases as a chapter. So understand this, that again, if we go back to the past papers of prelims and mains examination, what you will find is that this topic is very heavily dependent on current affairs. So this is a chapter we see that a lot of questions that come, whether prelims or even in mains, whenever they have come, we see that the questions are largely from the perspective of your current affairs. So, any current affairs related to health, any new disease surfacing, or anything that is making the headlines a lot. In all these cases, we see that questions, whenever they have been asked, questions always have been asked from these areas. So, both at prelims and mains level, there are some important areas which from examination perspective you have to understand. There are some areas where questions although haven't been asked yet, but there are chances that they'll start asking questions. So I'll just highlight those areas also for you, from where until now we haven't seen any question, but it's my hunch, I would say, that now questions should start coming from these kind of areas also. So let's have a discussion on all these things. So, first and foremost, when we are talking about health and disease, what do we mean by a disease? So, when we say that something is a disease, it means that there is a malfunctioning process that interferes with the normal functioning of the body. So, anything that uh, does not let the normal functioning normal body to function normally, we see that that can be called as a disease. Now, in general, when we talk about any given disease, there are two ways in which we classify a disease. One called as congenital disease, and then called as acquired disease. All right, congenital and acquired diseases. Now, in terms of congenital diseases are the ones that are present since birth, all right, or at the time of birth. All right, so the diseases that are present at the time of the birth could be called as congenital disease. That many a times you might have heard that there are newborns who are born with a small hole in their heart, and this is something that they are born with many a time. So this goes as a congenital disease. Similarly, there are acquired diseases. So acquired diseases are the ones that you would acquire over a course of your uh, life, right? So that's why they are called as acquired. Now, this acquired disease can be of two types. Either it will be called as a communicable disease, or it will be called as a non-communicable disease. So when we say that it is a communicable disease, the meaning of communicable is that it can be transmitted from one person to another. All right. So when a disease can be transmitted, it will be called as communicable. These are the ones which are also called as infections. So when we say that we have an infection, very commonly used term, infection. So when we say infection, the meaning of infection is that it is a communicable disease, Communicable meaning that it can be transmitted from one person to another, maybe an animal to a human, maybe even a plant to a human, any organism to any organism. Anything or any disease that can be transmitted can be called as communicable disease. Now, in this particular scenario, when we are talking about communicable diseases, we what we find is that large number of these diseases, majority rather, I would say, majority of these diseases, they are based on some kind of pathogen or the other. They are caused by some kind of pathogen. All right. So they are largely pathogen based. Maybe a virus, maybe a bacteria, maybe a protozoa, maybe a worm. It could be anything. Just that they would be based on some kind of pathogen in most of the cases. Then there are non-communicable diseases. Non-communicable diseases are the ones which cannot be transmitted from one person to another. All right. So they remain confined in the person who's suffering from that disease. So these are called as non-communicable diseases. So if you see, there are multiple different types of non-communicable diseases. For example, there can be degenerative diseases. So when we say degenerative, these are the diseases that would happen because of malfunctioning of vital body organ. That some part of the body is not functioning properly, and because of which we see many a times the degenerative diseases might occur. Now, in case of degenerative diseases, what we normally observe is that normally these are diseases that actually happen with age. So they are more common in aged population. So what happens is that there will be a time, let's say in the 50s and the 60s of a person, when some of the body organs, they may not be able to function very well now as compared to how they used to function. So that's why in these kind of scenarios, they would now start to show the symptoms of these kind of degenerative diseases. For example, osteoporosis. In case of osteoporosis. Now, in case of osteoporosis, what we see is that this will be a disease in which case, in the case of which, what will happen is that the people who are suffering, their bones will start to become brittle. The bones will start to brittle, and the bones are not able to get a lot of calcium or get a lot of vitamin D. And because of that, we see that many a times they would start losing on the bone strength. And because of that, many a times what will happen is that these kind of people who are suffering, they might get into accidents very easily. I mean, bone fractures might happen much more easily as compared to usual. So that's why this is something which is called as, and we'll discuss about this at a later stage also. So this is what we call as a degenerative disease. Similarly, we have deficiency diseases. So deficiency diseases are the ones which will often happen because of deficiency of one nutrient or the other in the body. Most of the cases we see that it happens due to lack of either vitamins or lack of minerals. In large number of cases, these are the uh, two micronutrients which actually can cause, or deficiency of these micronutrients can lead to deficiency diseases. Then after that, there are allergies. Now allergies, basically we say that allergies are nothing but hypersensitivity of the body to contain to certain foreign substances. That what may happen is that our body, for some reason or the other, does not respond well to some kind of external agent. So maybe it could be a dust allergy, maybe it could be an allergy against a food item, it could be anything. All right. So hypersensitivity, meaning that we are more sensitive against these kind of agents. And hence, let's say somebody who has an allergy against something, they would face a lot of difficulty. It could be anything. It could be difficulty in breathing, it could be some kind of skin reaction, it could be anything that may occur. Now with allergies also, what we see is that they are very individual in nature. All right. So for example, if I am suffering with some allergy, I would not be able to spread this allergy to somebody else. People who are, let's say, living in my surrounding areas, they would not also get the same allergy. And it's not also genetic in nature. So it's not that I'll also transmit it to my offsprings and so on, or I have gathered this from my parents, that's nothing. So it's nothing like that. So what happens is that in allergies, what we see is that allergies are individual in nature. They are confined to an individual. They are confined to an individual. So it will not be transferable. It would not transmit, or neither it is genetic. All right. So this is what we see with allergies. Then after that, the next one is cancer. So in case of cancer, we see that there is an uncontrolled growth of cells or tissues. Uncontrolled growth. Now, what do we mean by uncontrolled growth? Generally, what happens is that in our body, we have a lot of cells, right? There are millions of cells in our body. Now, all these cells in our body, they continuously keep on growing and developing, and they die and they get replaced. And this is a very continuous process for the body. For example, by the time I end one sentence, in that span of time, almost 10 lakh cells in the body will be replaced. So that's quick, right? That's very, very quick. So what we see is that this is a continuous process, that cells will keep on growing, cells will develop, specialize, die, and get replaced with another cell. And this is a process which is continuous for the body. Now, in case of cancer, what we see is that anyone who's suffering from cancer, there the cell growth becomes uncontrolled, and then they start to form a lump, and that is where we say that it is something called as a tumor. So this is a problem that happens, and there are two types of cancers generally that we observe. One is called as benign cancer. You'll write it clearly. One is called as benign cancer, and the other one is called as malignant cancer. So one is called as benign and other one is called as malignant. Now, benign cancer, the thing with benign cancer is that it remains localized. It remains localized, meaning that wherever it has happened, it just remains at that particular point. So it does not spread from there. It does not spread to other cells, other tissues, or other parts of the body. It just remains confined. So because of that, it's easier to treat benign tumor or benign cancer. It does not become fatal, it can be treated and it will remain localized, so it's fine. The second one is the problematic one. Malignant cancer is the one that spreads. Malignant spreads to other parts of the body, to other cells and tissues, it would spread. Now, because of that, it becomes very difficult to control malignant tumor. And many a times, what may so happen is that benign tumor might also convert to malignant, become malignant, and then start to become a big challenge for the person suffering from it. Or in case of malignant tumor, in general, controlling it, capturing it becomes very, very difficult. So that's why we see that these are the two types of cancer. Now, with cancer, the problem, understand the basic problem that we have with cancer. The basic problem is that we don't know what causes cancer. So don't get confused here. You might know that, okay, there are certain things that can lead to cancer. So that's why we say that these are factors. All right, these are factors that can lead to cancer, but we cannot say that these are the exact causes of cancer. These are the exact reasons for which you can say that cancer will happen. So that is where the problem lies, that even with those factors, sometimes somebody might develop cancer, somebody may not develop cancer with the same thing. So that's why, for example, let's say when we talk about tobacco, smoking. So we know that smoking can cause cancer. Smoking can be a big factor. It has been a big factor for lung cancer, especially. But there are people who wouldn't actually suffer with cancer even with heavy doses of or heavy addiction to tobacco. So that's why sometimes it becomes very difficult for us to even understand that in what cases cancer is happening and under what circumstances does cancer doesn't happen. So because we haven't been able to identify that, we haven't been able to capture that reason, that becomes all the more difficult for us to even think of a therapy or think of a medical procedure that can act against cancer, or a medicine or a vaccine that can act against cancer. So that is something that becomes very difficult with cancer, and that's why it's so difficult to contain. And then there can be some other physical reasons for other diseases as well. So overall, just understand this, that this is how we look at the various different types of uh, diseases. So you have the acquired diseases, where uh, it can be either communicable or non-communicable, and this is basically what we have just discussed. When it comes to communicable, as we discussed, that it spreads from one disease person to another, and it could be via various different ways. So there are two different ways in which we classify the modes of transmission of a communicable disease. So what we know is communicable diseases are the ones that can transmit from one organism to another, or one person to another, let's say in case of humans. So then in that case, what we have to do is we have to identify the pathways. So we say that there are direct pathways and there are indirect pathways. So direct transmission first could be because of what, direct contact between the infected person and the healthy person. So that's why we see that this can happen. And again, in case of pox virus, chicken pox, smallpox, etc., we see that these are diseases that can spread via contact. Then there is droplet infection. So in case of droplet infection, this is something that will happen when, let's say, tiny droplets or of mucus, etc., is released by somebody, maybe because of coughing or because of sneezing and all that. So then in that case, what happens is that when somebody coughs or sneezes, then they release some droplets into the air, and these droplets would contain tiny virus or bacteria. And then for the people who are in the surrounding areas, they might also breathe in these microorganisms, and then they might get infected with that disease. Prime example for us, COVID-19. In case of COVID-19, this is what we have seen, that COVID-19 spreads very easily, and that is why we had to mask up, we had to wear the mask, so that we can prevent the disease, either us also from the chances of catching it from somebody else, or if we are infected, at least by wearing that mask, we can ensure that we are not the ones spreading the disease. So that's why this is called as droplet infection. Then after that, even contact with sorry, contact with soil contaminated with disease causing virus and bacteria can also lead to such a problem. So this also is something that we know of. And then animal bite, rabies for example. In case of rabies, what we see is that if, let's say, a rabid animal bites somebody, then that person has a chance that rabies might develop in that person. So that's why animal bite like this will also be counted as direct transmission, because the rabid animal, the animal, let's say dog who has bitten somebody, the dog already was suffering from rabies, then only the transmission of rabies happens. So that's why these are all modes of direct transmission. Then there are modes of indirect transmission. Indirect transmission, first and foremost, it could be because of certain vectors which are carriers basically, like house flies or mosquitoes or cockroaches, etc. They can be the carriers of the disease. Now, if I ask you, what is the difference between a dog bite, because we are counting it as a direct transmission, and a vector borne disease where we are counting it as indirect transmission? So for example, let's say a dengue or malaria would be counted as indirect transmission, whereas rabies will be counted as direct transmission. So why are we making this distinction between the two? Yes, Avni, perfect. Your answer is correct. That dog itself is infected. That's the answer. That in the first case, the animal that has bitten somebody else, they basically they basically are already infected. Whereas when it comes to these vectors are not infected. They are just carriers. They're just carrying that pathogen. They are not infected. Malaria, I mean, the mosquito does not have malaria. Mosquito is just carrying that protozoa that that can cause malaria. All right, so that's the basic difference, as some of you have rightly pointed out. Then there are airborne diseases. So in this case, what we see is that the particles or cyst, etc., might remain suspended in the air, and then somebody who breathes in that air might get infected with that disease. Then they can be object borne, or also called as fomite borne. So when you have contaminated articles, maybe doorknobs, etc., which can already have the pathogen residing on it, and then somebody who touches these surfaces might get infected. Again, take the case of COVID-19. We know that there different types of surfaces uh, could let the virus live for certain amount of time. Some surfaces maybe 6 hours of time, some surfaces maybe even 12 hours to 15 hours of time. So we know that they could reside on surface and not die and remain there for a very long time. And then somebody touches that surface, that person can get infected with COVID. So that's why we were asked to wear the gloves, right? We were asked to wear the gloves so that we can save ourselves from touching any surface as such, and so that we do not get diseased. It was a very different time. I mean, I just remember 2 years back taking the same class on the same online BHLP class. We would have to, I would come to office to take that class, and nobody would be there in the office. Not a single person apart from just one guard at the gate, and then nobody in the office. Before leaving the home, I would wear the mask, wear the face shield, wear the gloves, and then leave. And then leave on my own vehicle so that I'm not getting in contact with anybody else. Come here without touching any surfaces, try to come to the studio room, record, or let's say take the live session, and again go back. And as soon as I would go back, just outside my door, I would just take away all the gloves and the mask, etc., just throw it away, just uh, run to the bathroom, throw all the clothes there, wash the clothes. And this was a daily routine. This was a daily routine every day for every class that we used to have. Fortunately, those days are almost gone, but we saw a huge devastation in the world. I mean, it's unimaginable the kind of things that we had to go through, the way the families have lost lives, the ways the families have lost their near and dear ones. It's unimaginable. Anyway, so then after that we have what waterborne diseases. These are the ones which are caused when water of or potable water is contaminated. So because of that contamination, a lot of diseases like cholera or diarrhea, etc., even hepatitis for that matter, in all these cases we see that they are all vector borne, sorry, all of these are waterborne diseases, and they can infect via water or contaminated water. So this is how we say that these are direct indirect modes of transmission. Then after that we have non-communicable diseases. Now for me, I would say that non-communicable diseases today become much more important than they have been. Questions haven't been asked from here. All right, if you look at the past papers, you'll see that there is no question that is being asked from here, more or less almost zero question being asked. But now I personally believe that the number of questions coming from this kind of an area will start to increase, or at least they'll start to show up. Many of these diseases, they have also been called as lifestyle disease. They have been called as lifestyle disease. Why we have named them or labeled them as lifestyle diseases? Mainly because of the fact that these are diseases that are occurring more and more in number. The occurrences in the world have been increasing because of an incorrect lifestyle that many of us have, and that leads to these kind of complications which otherwise should not have been found in people who are young. We see that there are so many now cases of even heart attack happening in people who are just in their 30s or 40s. uh, a lot of young population suffering with diabetes, which was unheard of for at least for the person who is not 50 years or 60 years old. So now we see that occurrences of these kind of diseases has been happening a lot in even in people who are younger. So that basically is a cause of concern, and that's why it has been named as lifestyle disease, mainly because many of these are happening because of wrong lifestyle that we have, incorrect lifestyle that we have. It is basically causing that problem, correct? So many a times we see that this has now started to become a bigger problem, bigger challenge for the world, and we have been trying to fight off all these kind of issues. Hopefully that what we need is a better understanding of our health, that what our sleep should be like, what our food should be like, how to avoid mental stress if at all that's possible. So there are so many things that we'll have to do, and these are the kind of corrective steps that we'll have to take, because these are not pathogen based diseases. These are not based on a virus or a bacteria and so on. So that's why those precautions are very different compared to these precautions, which are completely something that we have brought upon ourselves. So that's why we see that the number of these cases of non-communicable diseases also has been increasing. Even blood pressure problems in the people who are young, which was completely unheard of. So that's why we see that there are all these issues, and ultimately these are issues that we need to take care of. So that's why any current affairs that you come across in the next 1 year, if you come across any current affairs related to the non-communicable diseases, I would say personally that they are going to be important, because now there's a lot of emphasis on these kind of things and how exactly we can avoid problems like these. Then after that, another topic that I would say is very very important from examination perspective is mental health, because what we also see is that the mental health issues in the world also have been on a rise. The number of occurrences, and if not occurrences, at least a better understanding has developed in the masses, in the population, about what mental health means and what mental health issues could be. So that's why we need to understand that also, that better, so that we have an idea about what mental health is. If you go by the definition that WHO has given, so according to WHO, this is what the definition of mental health is: that it is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So, this is what the definition of mental health is according to WHO. That it is not saying that it is absence of stress or it is absence of problems in your life, but it's about managing those stresses, it's about managing those problems. And somebody is able to manage those problems, manage those stresses of life, they would be said to be in a state of mental well-being. But then if that's not the case, then in that case there are mental health issues that can develop. Now overall, what we understand today is that the number of these cases, they have been on a rise in India as well. That when we are looking at some of the data with regards to India, we do understand that the data in India also is not very promising, and number of these cases actually have been increasing. So so first and foremost, when it comes to, let's say, when we talk about these issues, what are the reasons, what are the basic reasons that can lead to these kind of mental health issues, and why do we see that these issues are on a rise? So first and foremost, changing lifestyle pattern, the same thing that we discussed for the non communicable diseases as well, that whether it is about sleep or whether it is about food, these are two things which are specially very very important from the perspective of lifestyle patterns. We see that there is a or even lack of physical activities. Lack of physical activities. So that's why we see that there are all these things that we can do, and these are the things that are actually leading to a lot of problems. For example, forget about just the mental health, but let's say we were talking about the non-communicable diseases as well. Today, a rising case also has been of deficiency diseases, especially if you read up on vitamin D deficiency. So you'll find that there are a lot many cases of vitamin D deficiencies as compared to what it used to be. And the basic requirement that we have of vitamin D, we see that a lot of people are not able to maintain even that. So much so that WHO even had to change what is the minimum required number. The minimum required number used to be very high. I think it was 20 nanograms per ml of blood or something like this, if I'm not wrong. You can just check that data on the internet. So I think it was 20 nanograms per ml. Now So this was the minimum requirement that was set, and below 20 you would be said that you have a deficiency. Now what we see is that there is so much commonality in people having this deficiency of vitamin D. So many people who lie in the range of 10 to 20, that now the bar has been decreased from 20 to 10, that somebody who now has less than 10, they are said to be deficient. People who are above 10, they are said to be fine. But I wouldn't say that under normal circumstances that's fine. And why is that? Our lifestyle pattern. Where are you sitting the whole day? Maybe in a room, maybe locked somewhere, maybe in an office, college, wherever you are. So in that case, our exposure to the sunlight has decreased a lot, correct? And this is one natural source of synthesis of vitamin D in our body, just exposure to sunlight. So now that exposure to sunlight has drastically decreased, we have seen that the number of cases of vitamin D deficiency have been on a rise. And you'll be surprised how many people have it. Many a times, what we see is that just that when people just go and get their uh, health checkup done, they find that they have a deficiency of vitamin D. So we see that these are all related to our lifestyle, right? It's related to our lifestyle, and that is where the problem lies altogether. Similarly, in case of mental health issues also, this lifestyle becomes a big part of the problem, because we understand that lack of sleep can lead to many kind of mental health issues. uh, very bad food habits are also associated with mental health disorders. Similarly, lack of physical activities, etc., also they are related to these kind of issues. So in general, a sedentary lifestyle is actually related to these kind of problems. Similarly, social stigma and discrimination can many a times also lead to mental health issues. The way the people are being treated, the way somebody is getting treated or getting discriminated against, can also amount to uh, a lot of these mental health problems. Then we see that there is one major problem also in today's world, and that is the career. The way we look at our career and the way we try to make or build our career, many times that also becomes a challenge, because then you take a lot more stress than you should, a lot more stress than the body can take. And then we see that a kind of a digression starts to happen from here, and people start to uh, develop a lot of these mental health problems afterwards. Similarly, extensive use of smartphones goes without saying that how smartphones have really changed the way we look at things, look at socializing, uh, the way you want to portray yourself. For example, let's say if you have a social media account, it's all about how you want to portray. It's not that many of us are trying to be real there. We're not really trying to be real. We are trying to portray a version of ourselves that we want people to appreciate, and that also puts a lot of pressure on you. You would want you would go and you would post a, you will think that you have posted a beautiful picture, and then you see that nobody is liking that picture. Perhaps you have just received 5 likes on that picture. That's enough for you to lose your sleep. And unfortunately, such a made up scenario, a fake scenario matters so much to us that it can play with our minds and it can lead to mental health disorders. So so that's why we see that whether it is the use of smartphones, because first of all, it is one thing that you are trying to portray yourself in a manner, in a certain way, and if you don't get that validation from uh, your social media friends and everyone out there, then you probably don't feel good, and that can lead to some kind of an issue. Apart from that, the other problem is the isolation, that the extensive use of smartphones has also led to a lot of isolation, that even if you are interacting with your friends all day long, you probably are interacting with them on WhatsApp. So, or you are just looking at YouTube, or maybe you are just watching something or watching your lectures even, but you are isolated. You are on your own with your device, with your machine, and your social interactions almost have stopped. So that kind of alienation or isolation also, we see that it amounts to mental health disorders. Then, lastly, there can be demographic and environmental determinants as well. That there are chances that because of the demography of a certain area, or even environmental determinants, for example, the kind of climate that you're living in. So, for example, let's say a constant cloudy weather or a gloomy weather is many a times also associated with mental health disorders like depression. that we see that there is a natural external cause that can actually lead to these kind of issues. So we see that there are multiple different factors that can lead to a mental health disorder in one way or the other. So that's why we see that this is something that actually can become a problem and has been becoming a very big challenge, because today when we look at the data for India, we understand that the data is not very positive, and we find that there are a lot of problems that we have. So for example, let's say when we talk about, let's say when I'm talking specifically about India, if I'm specifically talking about India, then first and foremost, we understand that majority of the people, first of all, have very little to no understanding of what mental health means. And there's a lot of stigma also associated with it, that you probably would feel that if you tell somebody that you are having some kind of mental disorder or some kind of an issue, you might feel that people might call you mad, or might not take the problem seriously and all that. So many a times even you avoid it. So we see that there is a stigma associated with it. There's a lack of knowledge that we have in India. So that also has led to a lot of problems. And for example, there was a research that was done in India, and it was done in 2017. And in this 2017 research that was done, it was found that in India there are a total of 197.3 million people who in one way or the other are associated with some mental health disorder, some kind of mental health disorder. 197.3 million people in India. Out of this 197 million people, what we see, I mean, the data estimates were that there are 45.7 million people here who are fighting depression, and there are 44.9 million people who are fighting anxiety, some form of anxiety. So these have been found to be the most common of all the mental health disorders in the country. So that's why we understand that this is basically becoming a challenge. Then apart from that, there were estimations also done, some kind of genetic research also done. And in all these cases also, we find that there are some genes also that can be heritable, and they can lead to mental health disorders being transmitted from the parent to the child. So overall, there are all these issues that we have, and more or less what we need is a much better understanding. So for example, one of the new initiatives that we see last year in the budget announcement, we saw that there was a considerable amount of money also allocated to this, that there was a national tele mental health program, national national tele mental health program, that was introduced by the government last year. And this basically would be a 24/7 free service available for counseling. Similarly, the budget that actually was allocated to this program was 932.13 crore rupees. So a significant amount of money also has been allocated to this, and we basically need to take a much comprehensive we need to take a lot of a much comprehensive approach here, because we need to understand the problems, we need to understand who's suffering from the problems, we need to train people well. In general, uh, people in the country, they also have to study, they also have to gain some knowledge with regards to what the problems are, so that we can understand the size of the problem better. Because still with all these estimates also, we don't really know whether these estimates are correct or not. That this was a 2017 estimate. I'm sure that during COVID-19, these numbers have shot up, and these numbers are much more than what we might know. And maybe there are many who are not even aware that they are suffering from some kind of mental disorder. That's also a problem, that many times we don't even discuss, we don't even know that these are mental health issues. So when we look at these mental health issues, there are some which are common. There, of course, are a lot more than what we have discussed here. But these are some of the ones which are the most common. First one being depression. So in case of depression, we are saying that this is a kind of state of mind where there's a persistent low mood, or there's a persistent loss of interest in activities, or even the daily activities, the basics of the activities a person is not able to do when they are suffering from depression. Now, depression is also a very misused phenomena, that we have to, for example, understand the difference between being sad and being depressed. That many a times what we see is that somebody would use the term being depressed very casually, that you would say that today India lost its match, so that's why I am depressed. Now, you being depressed because India lost a match today does not make sense. You are sad because India lost its match. The day India will go to West Indies and win matches again, you would also be happy. So that's why it's not a state of depression, but rather it's a state of being sad. And many a times this is very misused term because of these cases. And often many a times what we also see is that people do not have a good understanding of what the state of mind could be and what this depression could be. That even if, let's say, I mean, it's not only about the patient, but it's also about the people who are living with the patient, or people who are friends or family with the patient. It also becomes their responsibility. It also has to be driven by them, that they start taking care of this person. Because many a times it is very very difficult for that person to even express what's the feeling like and what they are feeling inside. And even if they do express that they might be depressed or they are feeling very low and all that, we many times we see that it is very much overlooked by people who are living with them, their friends, their families, etc. And that also is a very problematic part altogether. That uh, because of my lack of understanding, I was not able to understand the problem that my friend was facing, and they probably need help in this particular point, but I'm not aware enough, I am ignorant, that I'm not actually able to help them. So that's why when it comes to these kind of mental health disorders, it's not only about the patient, it's not only about the person who is suffering from this kind of a disorder, but at the same time it is very very crucial even for the others who are living with this person, or who are the friends or families of this person, to also understand their issues and to address those issues and help them through those issues. But in depression, largely what happens is that the person would lose all the interest, would be persistently in a very low mood, not able to do the basics of their life right, not able to indulge in their hobbies. So there are all these issues that will start seeing or on in the patients who are suffering. Depression worldwide has been seen to be the most common of all the mental health disorders. It can be very severe for them, for some of the people, and if it is very severe in its form, then in that case, first somebody would be asked to take therapy or go to a therapist, or maybe go to a psychiatrist in very extreme cases, or even maybe they'll be prescribed with antidepressants, so that depression can be count, uh, uh, can be countered. So sometimes this can happen, and we do see that there are issues where it can lead to this kind of a problem as well. And that's why antidepressants will be required for these kind of problems for many. Then after that there is anxiety, which probably is the second most common of all the mental health issues. Now, in case of anxiety, what we see is that there are feelings of worry, or fear or anxiety, which is very, very strong, that to even play with the normal functioning of the life, or the normal activities of one's daily life. Now, see, understand the difference between again anxiety and anxiety disorder. Now, once in a while, you might feel anxious because of something. Let's say the first time you start when you enter the examination hall for the first time to write the prelims examination. I don't know anyone who will not fear that moment, or who will not be afraid of that moment, because you also know that there is a lot at stake, and you want to do the best in the given scenario. So obviously, you initially will feel that fright, you will feel that fear, but ultimately what happens is that as you start reading the questions with the first or the second questions, etc., you will start settling into the question paper, and that initial hesitation, the worry or the fear that you had, now slowly and steadily starts to go away as you focus on your question paper. That's normal. That can happen with anyone. But when it comes to anxiety disorder, in case of anxiety disorder, the person who is suffering from anxiety disorder may not be able to function well at all. That it would become impossible for them to even attempt that paper. They'll not be able to do that. They might not even feel ease at breathing. And it becomes such a difficult task for them to even just sit naturally in a given surrounding when they become anxious. So that's why anxiety disorder in that sense is very, very different from a normal sense of worry or fear or being anxious once in a while. So, and then again, there are medicines like Anxet, etc., which are anti-anxiety treatments that would be prescribed for some, not all. Now, overall, when it comes to these two, these are, as I told you, that these two are the most common of the mental health disorders. Also, what needs to be done in these cases is not only, it's not only about recognition of these cases, but also to treat it as a disease. Because just think of this, that when do you take a paracetamol? When you know that you have fever, when you understand that you have fever and you know that there is a medicine for this fever, paracetamol, Dolo 650. So you'll just go to the medicine shop, buy Dolo 650 and eat it. um, just go and eat it for as easily as available it is. So unfortunately what happens here is that in I mean fortunately I would say, in those kind of cases, at least you acknowledge that this is a disease, right? You acknowledge fever to be a symptom of a disease, so that's why you take a medicine against it. The problem with mental health disorders is that we don't even acknowledge and accept that this is a disease, this is a disorder, and we need to take care of that disorder. So just like how we go and visit a doctor in terms of a physical manifestation of a disease, similarly in case of a mental health disorder, it is also required of the person to maybe seek some help from a therapist who is professional to help you through this kind of a scenario. Or maybe in extreme cases, if required, even psychiatrists could be required. But at least to acknowledge that this is a disease and then start taking corrective measures is required. It's not that it's an unsolvable problem. There are people who just come out of these kind of mental states with flying color and they wonderfully live their life well after that. But before that, at least this acknowledgement of the disease is so important when it comes to these disorders. Then there is bipolar disorder. Now, in case of bipolar disorders, we see that there are mood swings that can happen, that the person would be uh, ranging from maniac highs where they are very excited to depressive lows where they feel that a depressive state of lowness in the mood. So we see that it can happen, and it does happen with a lot of people. With bipolar disorder, we also have seen it to be genetic in nature. We have seen that bipolar disorder can actually be genetic in nature, and that's why it actually can lead to these kind of issues. Then there's something called as dementia. Now, in case of dementia, what we see is that it is a scenario where a person starts to forget the basics of their life. Even the most basic things that you can imagine in your life, they might start forgetting them. So normally it is something that is a degenerative mental health disorder, that it only happens with age. We see that with age, a person who is very old might start uh, facing this problem of dementia. Then there is schizophrenia. Now, in case of schizophrenia, what we basically see is that this affects the ability of a person to think, feel, and behave clearly. Now, many a times, what happens is that people who are uh, schizophrenic, they become delusional. They have delusions. So delusions where their mind is basically showing them some different scenario, which is completely different from reality. So they start, many a times they start imagining things, they start living according to those things that the brain is telling them, which can many a times also lead to some kind of self harm as well. Two of these mental health disorders, depression and schizophrenia, they very often also have been linked with the suicide cases also. So that's why these kind of things have to be taken very seriously and have to be managed well. And then there is something called as obsessive compulsive disorder, or OCD. Now, in case of OCD, what we basically see is that there will be excessive thoughts that lead to repetitive behaviors or compulsions. That anyone who is suffering with OCD, now see, all of us, we like some kind of pattern in our life. So it's not that we are completely devoid of patterns. But when it comes to a person who has an OCD for any kind of thing, then in that case, these kind of feelings in them will be very much heightened, and so much so that it again starts to interfere with their daily life. So, for example, one of the most common obsessive compulsive disorder is the fear of germs. And you might find that there would be people who would keep washing their hands all the time, keep disinfecting all the time. So whether or not there was a requirement, but they are just obsessed that they have to just take care of it. So, and I'm not even talking about the post COVID era, I'm even talking about the pre COVID era, that these kind of things actually have been observed in people. So that's why that becomes OCD, where you have very strong feeling towards a certain kind of thing, and you don't want any disruption in that to happen. And that's why you would make sure with everything that those activities, those processes, those things are being done by you exactly as they should be. So everything, whether it is arrangement of everything in at your home, whether it is about your food, whether it is about anything, or even washing hands, as I told you. So that's why there are all these different types of mental health disorders. So as I told you, my understanding or my belief is that mental health disorders are going to be very very difficult, sorry, very very important for your upcoming examination, both at prelims and at mains level. I would say that this is one topic to emphasize upon, to understand well. Until now questions have never come from here, but I personally believe that in the coming years questions will start coming from here. All right, so that's what mental health is. Then one last topic from this chapter is drug resistance. Now, in case of drug resistance, understand the meaning of the term drug resistance. We are saying that this is resistance in the reduction, sorry, it is the reduction in the effectiveness of a medication. Meaning that with drug resistance, there our body may stop responding to certain drugs. That even if you are taking those drugs, they are not playing any role in your body, they are not curing you of any disease. So then in that case what happens is we say that it is drug resistance, meaning that there is some kind of pathogen. What basically happens here is that there is some kind of pathogen in your body that has now become resistant. All right, that has now become resistant, and hence it does not um, get affected by any medicine. So any medicine being taken against this pathogen is ineffective. It used to be, if it used to be perhaps effective, but now it is not. Now what we basically see is that the number of drug resistant cases, resistance cases in the world has been on a rise. That number of these cases have been increasing, and that's why it has become a kind of worrisome situation for many. That, and that's why we have been today taking a lot of steps to counter this menace of drug resistance. So drug resistance or antibiotic resistance, basically resistance that develops in the in the microorganisms or in the pathogens, and they do not get affected by the medicines that used to work on them. So now those medicines are not even working on them anymore. So this is called as drug resistance. Now, in case of drug resistance, how exactly it happens and how it basically functions is that first and foremost, we'll see that out of a lot of germs that we have in the gut, there are probably a couple of them which are drug resistant. Now, when we take a medicine or any antibiotics, the antibiotics probably would have killed all the normal versions of that germ or that pathogen, but the ones which are resistant, nothing would happen to them. So then in that case what happens is that these would now start to increase in their numbers, they would start to multiply further, reproduce further, and their numbers increase. And even the ones uh, which were non drug resistant, even they will be converted, they will also undergo mutations, and they will be mutated towards this kind of a drug resistant pathogen. So this is basically the manner in which it happens, looking at the various pathways, various ways in which drug resistant could spread. Now, over overall what we basically see is that in this particular scenario, uh, the problem that we have been facing is that there are multiple different pathways. All right, there are multiple pathways that can lead to these kind of issues. So these multi so just try to understand, and this is what we are depicting in this particular picture, that what are the various pathways. So I'll just keep noting it down also so that you have it for your revision. So just first, let's try to understand this figure, that what can happen, that let's say somebody has taken an antibiotic. All right, now these antibiotics basically, although being taken, the problem is that there is resistant bacteria that develops in the gut because of misuse of antibiotics. All right. uh, so there, now there is this bacteria, that these are the bacteria which are antibiotic resistant, residing in the gut of this person. Now for everyone who's living with this person also, because this person will be of course living in a community, this drug resistant bacteria will also be transmitted to others who are also living in the same areas. So that's why this is the next problem. So it starts to spread in others who are living with this person. Similarly, let's say if this person visits a hospital where you have a lot of patients where already the immune system is fighting something off, so then in that case already the body is weak, and the bacteria or the pathogens might enter the body of all these patients as well. So from one person like this, we see that this drug resistant bacteria will keep on spreading to others. Now this is not a disease, all right, this is not a disease that is occurring, but it's very similar to how the disease occurs. That for example, in case of COVID-19, we have seen that how fast things can move from one person to another. Similarly here also, but without symptoms. In this case, without symptoms, it will just keep on moving and they will just keep on residing. They can cause a complication at a later stage, but right now they'll just start residing in the bodies of all these individuals. So that becomes one pathway where one person can keep on spreading it to others. Similarly, another pathway could be through animals. In animals especially, what we see is that they are administered with a lot more antibiotics than they should be. So if one tablet was supposed to be given, two tablets or four tablets will be given. That, who cares? I mean, uh, these are animals, so we don't really take that much precaution when giving them this kind of a medicine or antibiotic. So what now happens is that the bacteria starts to develop inside the gut of this animal, and then in that case, slowly and steadily, they would also start increasing in their number. Now let's say through the feces of or the animal waste that is generated, we'll see that through these feces, now they will also start to become a part of the environment, mix with the soil, mix with the water bodies, and spread. So that's why we see that there are multiple pathways like this that can take its course and can lead to these kind of issues. So understand the problems. The first could be the misuse of antibiotics. Now, this is a big problem. I mean, you talk about, let's say, maybe our own country, and I'm not sure how many of you also have this habit, that if I say fever, you would say Dolo 650. That you just know that, okay, it's fever, take Dolo 650, you are done. Take any paracetamol, you are done. But did you try to know what was the symptom? Why fever? Fever is not a disease, but rather a symptom. It could be a symptom of a lot of different things. So you don't care. You just know that if you have fever, you can take paracetamol and you'll be done. Similarly, the problems lie with the fact that we can simply just Google also. That you just Google your symptoms, Google will tell you what medicine has to be taken, and you will simply go and just buy that medicine. So many times these are wrong practices. These are wrong practices, and many times this becomes one of the major ways in which we increase the chances of antibiotic resistance. So that's why we have to have that kind of an approach. All right, we have to have that approach, that we are not really doing anything that goes beyond what is required, and we have to take a very informed healthcare seeking behavior. We need to have that, that you have to consult the doctor, work on those prescriptions, based on those prescriptions only, go and buy the medicine. Many times we just go to the medicine shop and say that, okay, these are the symptoms, you only tell me what medicine to take. And the shopkeeper also is experienced enough to understand what kind of medicine can be taken, and hence they would simply just give you the medicine, and your transaction is complete. Similar to what happens is that if you go to uh, a bookshop which sells books related to UPSC preparation, you ask them, you just go and ask them whether they know which books to be read. They'll give you the entire set. Like, these are the books, just go and read it. So same happens with, unfortunately, with medicines as well, that you simply go there, you ask them, and they give you. Similarly, another problem that has started happening today is also related to the online sale of drugs. That there are so many websites and apps where you can easily go there and you can simply uh, get the medicine from there. You can order the medicine from there. They would give you a doorstep delivery of the medicine. They do ask you to upload a prescription, but that also goes down to whether those prescriptions are true or whether they are fake. If they are fake, whether the other person on the other side is even checking that the prescriptions were fake, that you could have just written it at your home, signed it by yourself, and uploaded a picture on that app so that you get the medicine. So whether the person who is giving you the medicine, whether that person had checked it or not for the authenticity of that prescription, many times I'm sure that they do not do it. So then in that case, this also has started to become a challenge altogether. So this becomes major, one of the major pathways where we are misusing the antibiotics. We have an uh, incorrect behavior here. Then apart from that, overdose or even underdose is a problem. So overdose, I'm sure you understand when you're taking more, but even underuse or underdose is also a problem. Let's suppose that you were suffering from some kind of disease and you went to a doctor. The doctor gave you a medicine to be taken for 5 years. That take one at in the morning, one in the evening, and take it for 5 days. Let's say this is what the doctor has told, that okay, fine, a total of 10 tablets have to be consumed. Now by the second day, you see that the disease is already gone and you're not really suffering from the disease anymore. So then in that case, you might feel that okay, fine, now that the disease is already gone, there are no symptoms that I see, so why do I need to even take this medicine for any way longer? So then you stop taking from the third day. So something that where you had to take a total of 10 tablets, now you have taken just 4, and now you are happy because you feel that the symptoms have subsided. Now, yes, symptoms might have subsided and you might already have gotten cured of that particular disease. But what may happen in such a scenario is that the bacteria or any pathogen that you have, the pathogen has not been killed, but rather it has just become inactive. It was in the process of getting killed, but it did not get killed. It just had become inactive. Now, because it did not die, it starts to prepare itself for the future, because now it knows what acts against it. Now it knows what it wants to work upon so that it can get that resistant towards even these kind of things. So that's why not only overdose but even underdose of antibiotics also can be a major problem. And then, as I just told you, that animal antibiotics are also a problem. Animal antibiotics are also a problem. So this also is something that we need to understand and we need to address. And overdose, I mean, this is largely about the overdose that we often see here. So these are pathways. Then there is one more interesting pathway also that was actually discovered, and this is basically through the drainage of antibiotics manufacturing units. Now, this was a case study that was published in the Hindu, where we see that what they basically had observed is that many of the drainage or the outlets that are coming out of the manufacturing units of antibiotics, they have traces of antibiotics All right, they many a times have traces of antibiotics. Now these traces of antibiotics, they just go on and mix with the drain water, and obviously in the drainage they you would have a lot of different pathogens residing there. So now what happens is that now that these pathogens, they are getting uh, exposed to the antibiotics, they would start to become resistant, and that's why some drug resistant bacteria were actually found in the drainage of these kind of antibiotic manufacturing units. So that's why this also can become a pathway, is what we have actually observed late. So that's why there are all these issues that we have, and that we need to understand how exactly can we take care of these problems. So there is this red line campaign that was started by the government of India, that there will be medicines that will come with a red vertical line. So if there is red vertical line, then they are the antibiotics which should not be taken without a doctor's prescription. So that's why they have been marked like this, that there will be a red vertical line on the tablet strips, indicating that you can't take it without prescription. So that at least is a better health seeking behavior, that at least even by yourself you can actually see this, and that's why these medicines have been named as the medicines with the red line. So both the perspectives, from the perspective of the person buying these medicines, also from the perspective of the person selling these drugs, from both the perspectives, it's very very important to have these kind of indications. Similarly, there are a lot of steps that can be taken, that we have to encourage proper and informed healthcare seeking behavior among the citizens. We have to educate the patients and the general community on the appropriate use of antibiotics, antimicrobials, and to create awareness about the dangers of taking antibiotics without being prescribed. So we discussed about, so it's basically about educating the patients, and then having an informed healthcare seeking behavior among the citizens, and then after that, to also educate all the groups of prescribers and dispensers, the people who are basically selling the drugs online or offline. They also have to be educated well. They should also be aware of their own responsibilities in this entire scenario. So that's why there are all these steps that are being taken. One more thing that we saw was that WHO also took a decision a few years back, and this was about a revision of the antibiotic protocol. That all the antibiotics have been divided into three categories: access, watch, and reserve. So access are the commonly used antibiotics which will not cause any instances of antibiotic resistance. They can be taken, they can be used easily without having any kind of side effect like this. They have been kept in the access category. Second is the watch category. Now in case of watch category, these are slightly more potent drugs, and they should not be taken without doctor's permission. So these are not to be taken without a valid prescription. Right, so they have been kept in the watch category. And then lastly, we have the reserve category, where we have the potent drugs which have to be used only as a last resort. And these kind of drugs, that's why they are also called as last mile drug. They are called as last mile drugs, or they are also called as last resort drugs. So now when it comes to the last mile drugs or last resort drugs, what we basically mean is that these are the ones that can be taken, or that have to be taken only when nothing else works, because these will be very potent. They can be very harmful for the patient also. There can be a lot of side effects as well. So that's why we generally avoid it until the time that there is nothing else that can be useful. Then in that case we would use the last mile drug. Now, in case of last mile drug, there was this instance that we actually had seen in 2015-16, and this was colistin. Now, colistin basically is a last mile drug. All right, it is a last mile drug, so that's why it has to be taken only in cases when nothing else works. Then it can be taken. But now, what we basically saw was that in case of colistin here, In case of cholesterol here, there was a drug resistant bacteria that could resist cholesterol. Now understand this, that this is a last mile drug, right? This is a last mile drug. So it means that you already are using it only when nothing else was working. And then you are saying that because of antibiotic resistance, even this will not work. So then there is nothing that works, because cholesterol being a last mile drug, if it has, if this has no effect or has no positive effect, then in that case there is nothing else that would work. So unfortunately, this had happened, and origin of this antibiotic resistant, no guesses here again, origin was China. That this also had started in China and then had spread very quickly to other parts of the world. That within the first 3 months after its detection in China, we saw that there were more than 35 countries which already were suffering, already had started suffering with this kind of a situation. So that's why we see that there are all these things, and this also has been done by uh, WHO, so that they can provide better support to these issues. So this is the end of this chapter. If you have any doubts, please let me know. Any doubts with regards to what we discussed in this particular chapter? Is antibiotic and drug resistant same? You can say that, because see, antibiotic resistance can be said to be a subset of drug resistance. All right, drug resistance can be resistance in antivirals, in antibacterial, in antibiotic, in every form. So that's why antibiotic resistance becomes a subset of drug resistance. I can't remember everything I read. Do I have dementia? Not at all. I mean, it's not a comparable case if you actually thought that it would be. That's not a comparable case at all. Because for people who are suffering with dementia, first of all, we see that they would actually suffer. I mean, the basics of life. I mean, for example, they would forget even their children. So it's very different. You can't really compare like this from the real scenario. Colistin is used for what disease? Colistin is actually used against a lot of different diseases. Actually, there is a set of diseases which are called as, I mean, set of bacteria which are called as gram-negative bacteria. Right? There are set of bacteria called as gram-negative bacteria. So, so any bacteria which is a gram-negative bacteria, against this colistin can be used. Can you please explain dementia once again? So, in case of dementia, what I'm saying is that uh, the person who's suffering would have very weak thinking and remembering abilities, and that's why they would just forget everything. The basics, the daily routine, their relations, they would just forget a lot of these things. So, that is what happens in case of dementia, which is actually seen with uh, people who are aged, people who are actually beyond a certain age. Demographic determinants re-explain. So demographic determinants means that we see that demography of a region many a times also uh, is something that can become a factor. All right, so that's why we so let's say the kind of population that you have, that density of population, for example, let's say, can also be actually a problem many a times. So so that's why we see that in these kind of cases, there are chances that something like this can actually happen. So even the age, or let's say even the marital status, there are so many things that can actually come in the demographic determinants. Anxiety disorder is when you have a fear for some situations. You can be triggered by certain situations, and then you have a lot of fear, you have a lot of and I mean you are very stressed out of some situations, and so much so that you are not even able to function properly in such a scenario, that you'll just become frightened of something which is very very simple, or you would develop a lot of tension because of some very simple scenario which others will be able to cope with very easily, but you may not be, because you are suffering from that anxiety disorder. And many a times these anxieties, they are associated with some kind of event or some kind of part of your life where you have a fear, you have an anxiety against it, and that actually can lead to a lot of issues. All right, so next topic for us is vaccines. So a couple of you have asked for a break. Let's take a break almost at 5:30 once. All right, we'll take a break then, and then we'll take a proper break. So let's hold on for half an hour more. So we are talking about vaccines. Now, when it comes to a vaccine, first and foremost, I have a question for you, that there is vaccine and there is medicine. What is the difference between a medicine and a vaccine? Any idea? What is the basic difference between a medicine and a vaccine? Okay, vaccines prevent, vaccine is taken before the disease is caused, medicine is taken after. Okay, right. So, hmm, correct. Medicine cure, correct. Medicine which we take after disease attack, and vaccine that is taken to prevent, correct. So, vaccines improve your immune. Okay, you can say that in a way. Vaccine is for infections, maybe. Okay, fine. So, a basic difference between medicine and vaccine is that vaccine will be taken to prevent, right? Vaccine will be taken to prevent, and medicine will be taken to cure. That's the basic difference, meaning that somebody who is suffering from a certain disease, they have to take medicines. All right, they would have to take medicines to cure that disease, whereas somebody who is not suffering with that disease has to be given a vaccine. So that vaccine is for prevention, that future occurrences have to be stopped. That is what vaccines are for. So vaccine cannot be given after you are already suffering. All right, after you're already suffering from a certain disease, you cannot take a vaccine and think that the vaccine will have an effect. No, vaccine has to be taken before the occurrence of the disease, and medicines will be taken after the occurrence of the disease. That's the basic difference between vaccine and medicine. Now, when it comes to the vaccine and medicine, what we basically see is that in case of a vaccine, what we say is that it is suspension of weakened, killed, or fragmented microorganisms or toxins or of antibodies or of lymphocytes that is administered primarily to prevent a disease. Correct? So, this is how we can define a vaccine. Now, vaccine basically will be taken before the onset of the disease to boost that immune system, so that immune system learns how to fight against a certain disease. So that's why, although as some of you have written, improving immune system, I wouldn't really say that it improves immune system. It rather trains immune system. All right, it trains immune system how to withstand a certain disease. So basically this training has to happen. Now, how exactly that training happens is what you need to understand, that how do vaccines work. So in simple terms, in most of the cases, what we basically see is that vaccines would mimic the disease agents and stimulate the immune system to build up defenses against them. And that's why many a times they are also called as pathogen imposters. They are also called as pathogen imposters. So now what happens in this case of a vaccine? Understand how vaccines work. What is the entire process of working of vaccines? So just try to understand the things through this particular picture. When the vaccine is delivered, all right, when the vaccine is administered to somebody, what we see is that these particles are being sent inside your body. These are called as antigens. These are called as antigens. So vaccines will deliver antigens to the body. So the question is, what is an antigen, right? The question is, what do we mean by an antigen? So antigen, basically, you can say that it is anything against which the immune system would launch an attack. And this means release antibodies. So we'll discuss about what antibodies are. So basically, we are saying that antigen is anything against which the immune system would launch an attack, basically releasing antibodies. So whenever and if antibodies are being released, then in that case, it means that it is trying to fight an antigen. So these antigens are delivered to the body. Now these antigens might be made of another virus. It can be made of another virus, or maybe another something which is toxic for the body, so that immune system recognizes it to be an enemy, recognizes it to be unwanted, and again attacks it. So this is something, this is what will happen with the antigens. So that's why antigens will largely be made of another virus of a very similar kind. Understand what we are trying to do. So once antigens have been delivered, all right, so some, what we see is that the first step would be that antigen presenting cells come, and these antigen presenting cells, these, they basically just keep roaming around the body. All right, they just keep roaming around the body, and they're like, let's say the night guards that many of us might have. So guards who just keep roaming around the colonies and the societies around, throughout the night, so that they can catch anything unwanted. So similarly here we have antigen presenting cells, and antigen presenting cells will just also keep on roaming around the body inside the blood cells. And as soon as they come in contact with any antigen, when they come in contact with any antigen, what basically they'll do is that they'll make sure that the antigen sticks to their surface. All right, the antigen would stick to the surface of the antigen presenting cell, as you can see here, that sticks to the surface of the antigen presenting cell. And then this antigen presenting cell, APCs, will take it to the T helper cell. All right, so it's just like that night guard who was just roaming around has caught a thief. So now that it has caught a thief, it will just take the thief to the police. So that is something that is happening here as well, that antigen presenting cells have just one role, that they would just catch hold of any antigen, they'll stick them to the body, and then they'll take it to the T helper cells. Now, from T helper cells, what we see is that T helper cells will analyze this antigen, and then plasma B cells will be first naive B cells, and then plasma B cells will be uh, created. Now, these plasma B cells, you can say that they are more like locksmiths. All right. So, why I'm saying that these are like locksmiths? Because they first of all will analyze this antigen, and based on what they have understood about the antigen, they would release antibodies. They would release antibodies, and antibodies basically will be released in thousands to lakhs in numbers. All right, thousands to lakhs in numbers, they would release antibodies, and these antibodies will simply go and lock themselves. All right, that's why we are saying that the plasma cells are like locksmiths, that the antigens are like the keys, sorry, antigens are like the locks, and antibodies are like the keys. So they will just go and fit in the antibody, sorry, they will just go and fit in the antigens. So like this we see that they will surround the antigens altogether by just locking themselves against all these antigens. So this is what the role of an antibody is, that it will simply go and act as a key and it will lock itself against the antigens. Now comes the role of the killer T cells. And what killer T cells do is that they basically would identify whatever has been marked by the antibodies. So antibodies basically are doing what? They simply have marked this antigen. They have just surrounded this antigen. So whatever has been surrounded, the killer T cells basically they just have to just go and destroy whatever has been marked by the antibodies. So that's what it will simply do, is that it will simply go and it will destroy these vaccine antigens. Now the question is that vaccine was delivered to prevent that disease, right? But vaccine now has been destroyed. The antigens that vaccine had delivered in the body, it has been destroyed. So if it has been destroyed, then how does it help? How does it prevent a disease? I'll tell you there are two factors here which becomes very very important. First, the vaccine antigen is very similar to the actual antigen. All right. So I'll just write it out here. Vaccine antigen is a very close replica vaccine antigen is a very close replica of the actual pathogen. All right. So vaccine antigen is a very close replica of the actual pathogen, meaning that in its structure it is very very similar. So for example, let's say in COVID-19 vaccines also, you might know that we have used in some of the COVID-19 vaccines, we have used virus. All right. And we have actually used coronavirus, a different form of coronavirus in some cases. A chimpanzee based coronavirus has been used in a couple of uh, vaccines. So that's why in this case we have chosen coronavirus. Why? Because COVID-19 also is something that belongs to coronavirus family. So that's why we chose coronavirus, a different form of coronavirus, which is structurally very similar, and that is being used in the vaccine. All right. So that's the first thing, that why are we using this, or what happen, what do we gain here? And secondly, what we see is that out of this entire process there are memory cells that are created. So memory cells are created. So these memory cells basically are nothing but, what we see is that memory cells would simply uh, would have just recorded everything that was happening. Just see this in this slide, that they would have just recorded everything happening. They were just sitting with the video camera and just recording the entire process of how antigen presenting cell captured it, how helper cells started the synthesis of B cells and the T cells, then how the B cells made the antibodies, how the T cells then lodged an attack uh, against this and against these antigens that have been blocked, that has been locked by the antibodies. So all these things are well documented, they all have been recorded well, so that they can use it in future, they can see it in future. And then exactly we see that this is something that happens. All right. That when the actual pathogen enters, when the actual pathogen enters the body, again it will come in contact with the antigen presenting cells. Antigen presenting cells quickly will ask for the memory helper T cells. So now what happens is that the memory cells are called upon, because structurally they are same. Structure wise, the pathogen enters the pathogen that enters the body is same as the vaccine antigen. So that's why it very quickly realizes that it is very similar in structure. So that's why it will call upon the memory T helper cells, and then memory B cells and the memory T cells will be formed. Antibodies which are very similar to what we saw last time would be formed, and the killer cells will simply go and just destroy the pathogen. So that's why by actually destroying the vaccine or the vaccine antigen, we now made we made a pathway in which the actual pathogen can also be taken care of. And this is basically what we do in terms of how vaccines basically work. So just understand the basics of how the vaccines work, and this is the entire pathway that first we see that the vaccine is delivered. Then after that it comes in contact with antigen presenting cells. Antigen presenting cells will call upon the T helper cells. T helper cells will make the B cells and the killer T cells. B cells will make the antibodies, and these antibodies will be produced in thousands to lakhs in numbers. And then these antibodies will just go and lock themselves to the body of the antigen. And then after that the killer T cells will simply go and kill or destroy whatever has been marked by the antibody. And all out of all this process that was used, memory cells are created here, meaning that now these cells have the memory of the process that was followed. So that's why when the actual pathogen enters, again antigen presenting cells will come in contact. They would quickly call upon, because now structurally they are same, so they will call upon the memory helper cells. And then memory helper cells will call upon the B cells and the T cells. B cells will make very similar antibodies this time also, and the T cells will simply go and kill that. So in this entire process we see that we are able to prevent a disease, and that's why we are able to prevent a future onset of the disease. Now, coming to the different types of vaccines, overall, what we have seen is that there are various different types of vaccines. Many of these vaccines have been used for the first time against COVID 19. Before that, these vaccines more or less did not exist. So, how do we classify? So, there are three ways in which we look at the classification: whole pathogen vaccine, subunit vaccine, and nucleic acid vaccine. Whole pathogen vaccine, the name tells you it has the whole pathogen in the vaccine. So there are two types of vaccines here, one called as inactivated vaccine and the other one is called as live attenuated vaccine. So inactivated vaccines are the ones where you are using the killed form of the germ. Killed form of the germ, meaning that let's say if it is virus, the virus already has been killed, and then after that it is being used. Live attenuated vaccine, on the other hand, we see that they are basically dormant. They are basically dormant or inactive. So that's why they are not going to cause any trouble as such. So they just remain confined. So they are alive, right? They are alive but dormant. So this is live attenuated vaccine. In most of the cases, you will find that the vaccines that have been made until now, apart from COVID 19, you'll find that all these vaccines have been one of the two, either inactivated or live attenuated vaccine. Then we have subunit vaccine. So, subunit vaccine is when you are using just one part, when only some part, only some part of the pathogen or toxin is used. So then in that case, subunit, because you are just picking up the part that can act as an antigen and you are using it. And then you have the nucleic acid vaccines, where we have the DNA or RNA based vaccines. DNA or RNA based vaccines, basically, wherever we are making the use of genetics. Wherever genetics is involved, it becomes nucleic acid vaccine. So here we see that again there are different types of all these vaccines. Look at this question and try to guess the answer. I have not taught you about this question at all, but I'm just saying you know the answer. Read these two statements. I'm launching the poll for you. Please mark your answers. Right. So, as I see, great, one more than 60% of you have given the correct answer. So, overall, when it comes to this, how do we exactly get to this answer? I mean, I've not taught you about this question, but just get the hint from the words that you see. First word here is recombinant. Where did we read about recombinant as a word? Where did we get introduced to this word? When we were talking about biotechnology, right? When we were talking about biotechnology, we had seen this word. And what was the meaning of recombinant DNA technology? Remember that? So in the recombinant DNA technology, two different DNAs were being mixed, correct? So genetic engineering is applied in the development of these vaccines, is correct, because we that's where recombinant word is being used. And vector. What do we know by about vector? We, if you remember, we discussed that vectors are nothing but carriers, correct? It is the carrier, and carrier could be both virus and bacteria. This is what we had discussed. So that's why bacteria and virus both are vectors. So correct answer, that's why will be C. Now, just looking at some of these important vaccines or the types of vaccines that we discussed, first we have the inactivated vaccines. So, inactivated vaccines are the ones where the killed version of the germ is being used, which causes the disease. And so, there are all these diseases against which we have used inactivated vaccine. Now, in India also, there are two vaccines against COVID-19 that we had used. So, out of these two vaccines, Covaxin that we had used, Covaxin is an example of inactivated vaccine. Similarly, we have live attenuated vaccine where a weakened form of the germ is being used. Now, in this scenario, again, we have seen that there are so many of these diseases against which we have some kind of live attenuated vaccine. And in India, Covishield is an example of live attenuated vaccine. So that's why we have seen that both these different types of vaccines have been used in India. Then apart from that, there is this mRNA vaccine, which also has been widely used basically in Europe and the US. So mRNA vaccine is based on messenger RNA. All right, this is based on messenger RNA. So when we say messenger RNA is the kind of RNA that is present in all our cells and has the instructions for making the proteins from our genes. Now, what we see is that when mRNA is transferred inside the body, when it is taken into the body, it will start making the proteins in the bloodstream. And these proteins will act as an antigen. So, mRNA basically will start making the antigen inside the bloodstream. And then we see that the same mechanism of what we discussed, the same mechanism takes place. So, mRNA vaccines basically they make proteins in order to trigger the immune response. So against COVID-19, for the first time, we see that mRNA vaccines were used. And two of the major names here, one has been Moderna and the other one has been Pfizer. These two basically were the mRNA vaccines that we use in this world. Then after that, we have the recombinant vector vaccine, or if virus is being used, then viral vector vaccine. So here what we are doing is that we are using genetic engineering and we are combining two different forms of viral genes in one single vaccine. And this against also we see that against COVID-19, this was used. So if you have heard of the Sputnik V vaccine, Sputnik V vaccine of Russia basically is a viral vector vaccine. So that's why we see that all the major vaccines of the world, they actually have used all these mechanisms. Then after that, in India, we had developed another vaccine called as the DNA vaccine. So now this basically was the world's first plasmid DNA vaccine, and this was produced in India. So that's why it was a very major event for us that we actually had made a DNA based vaccine first in the world. Now, very important with DNA vaccine is also the fact that it helps to fight against vaccine hesitancy. Vaccine hesitancy. So, vaccine hesitancy basically is a word associated with somebody not taking the vaccine for one reason or the other. So for example, let's say you don't like needles, you are afraid of needles. So you are afraid of needles, you are afraid of that pain, and hence you don't want to take the vaccine. So that is called as vaccine hesitancy. So there can be n number of reasons that some believe that, let's say, vaccines will not work. I have seen one case where a person who took vaccine also lost their life. So then in that case, why should I trust the vaccine? So there are n number of reasons for somebody to have that hesitancy. So one kind of hesitancy that can be fought is the needle problem. So in case of this DNA vaccine, we are not using uh, we are not using needles, but rather we are using something called as pharmajet. So if you have heard of the nasal vaccine, right? If you have heard of the nasal vaccine, so nasal vaccine basically is this, where you are trying to avoid injection, and instead you are taking a different form of the dose. Then when it comes to the vaccines, we understand that the vaccines have a different types of uses, but mostly we know that it is basically made of that antigen, correct? Vaccine has an antigen, but apart from the antigen also, and it definitely has the antigen, but apart from antigen also there are all these different things also that are present in a vaccine to make that vaccine stable, free of any kind of let's say contamination or decomposition or any chemical reaction, and so on. So that's why there are preservatives or surfactants, diluents, residuals, stabilizers, and adjuvants. All these are also a part of the vaccine. So for example, when it comes to the preservatives will help ensure that it can save the vaccine from contamination. Similarly, we have stabilizers. So in case of stabilizers, what we see is that they would prevent the chemical reactions from occurring within the vaccine. Then so they would prevent the chemical reactions. Then we have surfactants, which will help ensure that all the ingredients can be kept together in the mix. Then residual. So residual would be the inactive ingredients, the ones that may have been left over from the manufacturing process, but they have nothing to do with the vaccine as such, no positive or negative impact. Then the diluent. So diluent is basically is to dilute the vaccine to the correct concentration, a kind of a solvent, just like water, for example, so that you have a mixed phase there. And then we have the adjuvant. Now, adjuvants actually play a very, very important role. All right. Adjuvants play a very important role because the role of the adjuvant basically would be to create some issues, create some local response. Because what may happen is that, let's say, vaccine has been taken and the immune system fails to recognize the antigen in the vaccine, and then the vaccine antigen will be excreted out of the system without having any effect. So then in that case, we have adjuvants. The role of adjuvants is that as soon as the vaccine is delivered in the body, adjuvants will start creating an issue. Let's say they start fighting. So it's just like, let's say there are goons who are fighting so that they can catch the eye of the police. So something similar is what they are trying to do here, that they'll start to create some local responses, local issues, and hence we'll see that the immune system will start rushing towards this, so that the immune system does not miss upon this vaccine. So that is the role of the adjuvant. So that's why we see that there are all these components apart from just the vaccine antigen. Now, one last thing to discuss is the efficacy of a vaccine. All right. So, efficacy, what do we mean by the term efficacy of a vaccine? And you might have seen these terms when COVID-19 vaccines were released, that there is one vaccine that has 95% efficacy, one has 67% efficacy, one has 80% efficacy. So, these kind of numbers were published for all these different vaccines. So, what exactly do we mean by that? Let's try to understand this scenario. So overall, when it comes to the efficacy of a vaccine, what we are basically saying here is that we calculate this efficacy and it gives us an indication about the effectiveness of the vaccine. How exactly that happens? Let's try to understand. First, to start with the clinical trials. All right. Clinical trials. Now, in case of clinical trials, what we know is that before a vaccine is released into the market, it will undergo clinical trials. First, there will be lab studies where a lot of research will happen. maybe stem cell based research will be done, study will be done, testing will be done on stem cells, maybe on some animals the testing will be done. So all these things basically are where you are doing the laboratory studies. Then after that, once we have seen it to be effective, once we know that this is something which is ready to be launched for the market, this is where we enter phase 1. And in phase 1, a small group of people will be administered with the vaccine. So sometimes 50, sometimes 20, sometimes 30, depending on the scale of the vaccine. We see that first stage, a very small bunch of people will be administered with the vaccine. Once everything has been found to be good here, once we see that fine, nothing is wrong and all everything is working fine, then we enter phase 2, where a larger group of people will be chosen. All right, 500 people. So again, the number is not fixed, it can be variable. When everything is seen to be fine here, it goes to stage 3, where you have a larger group, and then finally it goes to an even larger group. And if all these four phases are fine, there is no problem, and then we'll see that the vaccine will be released for the market. Now, while phase 4 study is being done, or phase 4 clinical trial is done, this is where we see that now we would also try to understand the efficacy of a vaccine. So, understand how efficacy is calculated. This is a case study of Pfizer, that what Pfizer had released about its efficacy rate. So, there were a total of 43,000 participants. Now, out of these 43,000 participants who were given the vaccine, who were administered with the vaccine, there were 170 participants who got infected with COVID 19 even after getting the vaccine. Now, basically, in this efficacy study or efficacy calculation, what we do is that we divide this group into two sets. So, you would have two sets of people, 21,500 each. All right, two sets of people, 21,500 each. Now in this particular scenario, what we see is that they would be divided into two groups. One group actually is given the vaccine, and the other group receives a placebo. Placebo basically is something that you believe it to be the actual medicine or the vaccine, but is actually not. So they have been told that they are getting vaccine, but in reality they are not actually getting the vaccine. Probably only water is getting injected into their veins. So then in that case, we see that there will be two groups into which they will be divided. So now let's say that both the groups, there were 85 and 85 participants who even who got infected with COVID-19. This number means that whether you have taken the vaccine or you have not taken the vaccine, it doesn't matter, because the people who have taken that, those they also got infected. The people who had not taken, they also got infected. So efficacy in this scenario will be said to be zero. Scenario 2, let's say all the 170 people who got infected were the ones who received placebo, and everyone who was actually vaccinated did not get infected. Then in this case, it will be said to be 100%. Then we'll say that efficacy is 100%. So this is how efficacy is calculated, that you divide population into two groups. One group will be given the actual vaccine, the other will be given the placebo, and then we will see how many are actually getting infected. The actual numbers were like this, that out of 170 odd people, there were 8 people who got infected, and there were 8 people who were vaccinated and got infected, and there were 162 people who had received placebo, and that's why they got infected. So then when we calculate this number comes out to be 95%. All right, so this is how the calculation is done. So the number was 95% for Pfizer. Now, understand what this number 95% means and what it doesn't mean. Because 95% does not mean that out of every set of 100 people who are getting vaccinated, 95 people will be safe and there will be 5 people who will get infected. It doesn't mean that. All right. It doesn't mean that. What it means is that if you have taken the vaccine, there are 95% chances that you will not be infected with the disease. Now, when we look at the numbers, we see that Pfizer had posted a number of 95%, Moderna 94, Sputnik 92, Novavax 89, AstraZeneca, which basically is the Covishield vaccine for us. This showed an efficacy rate of 67% and Johnson & Johnson 66%. Covaxin had shown an efficacy rate of 78%. So these are the efficacy numbers. But now many a times these efficacy numbers are also not well understood. All right. Understand the role of a vaccine. The vaccine basically needs to do this, that either there should be no infection at all, or no symptoms at all, or even if symptoms, moderate symptoms. So either no infection or asymptomatic or very mild symptoms. This is what the vaccine needs to do. That vaccine needs to protect you against severe symptoms, against hospitalization, or against unfortunate death of the person. So the vaccine needs to save against these cases. Now, what happens is that when we look at the efficacy numbers, we are only looking at no infection scenario many a times, because when we look at these three scenarios, then in that case, we can very easily say that all of these have shown almost 100% efficacy, that all of them have been effective, all of them have been able to contain the disease. And that's why from that perspective, when we are counting the efficacy rates against death and hospitalization, we can easily say that it all has been 100%. So that's why efficacy numbers have to be understood, that what it means and what it does not mean. That even when the efficacy numbers for Covishield was seen to be just 67%, it has turned out to be one of the most effective vaccines against COVID-19. So that's why many a times they did not give the correct picture. So this is about this chapter of vaccines. Next we'll enter defense, but after the break, let's take a break here. uh, if you have any questions first, please let me know. Any questions from the vaccine chapter? All right, great then. So let's take a break now. Let's be back by 6 p.m. Let's be back by 6 p.m. and then after that we shall continue with our next chapter, that is defense.